3.
Hi there, thank you for tuning in. My name is Samantha Hampson. I'm the clinical director at the Blanchard Institute. I'm here to share with you some of the foundational material and education that's important to understand when we're exploring family systems. Today, I want to give you some personal disclosure. I'm a licensed clinical social worker. I'm a licensed clinical addiction specialist. I'm a certified supervised intern and an internationally certified advanced alcohol and drug counselor. We're going to start off by just talking about some of the anatomy of a family and recapping a little bit of the information that's important to understand when we're talking about the balances and the imbalances that happen. So when we talk about what happens in the brain, both for family members and for our clients, we know that there's an imbalance in chemicals between the endorphins, the dopamine, the serotonin, and the oxytocin. What that means is we're having a huge difficulty connecting. We're having a lot of difficulty really getting engaged with others, staying connected. Our tendency is to isolate when we're not doing well. The tendency of our identified patient is to isolate when they're not doing well. And what happens is we put endorphins, we put dopamine all in overdrive. And so what happens is we become disconnected from our communities, we become disconnected from others, and we become really reliant on the chemicals that keep us going. And so what we're constantly looking for is this balance. We're looking to restore the connection with others. We're looking to balance out the brain systems that have become in overdrive with that cortisol, with the endorphins, and with the dopamine. What we know is the stress on the human body, both for caregivers and for the identified patient, is very significant. We know that when we're under extreme stress, the frontal lobe completely turns off, or there's an override happening. We are operating so much more out of the limbic system, so much more out of this really caveman part of our brain that was designed to help us survive. And so our decisions become illogical, they become very pleasure-driven, very pain-avoidant, and that results in some of the imbalance that we're talking about here. The good news is, like identified patients, as family members, if we're leaning into the recovery process, if we're educating ourselves like you all are here today, what's happening is our brain is changing again, it is rewiring, and all of this can get a whole lot better. And so when you see these brain images, what you're gonna see is folks who have not engaged in education, not engaged in family programming, and some of that coping for yourselves, some of that family recovery work. And you'll see the difference in the brain between the families that are coping and the families that are avoiding some of that process. And so what we ask of you through these modules, what we ask is that we're leaning into this process, we're trying to learn, we're trying to start conversations, and just overall working on ourselves and no longer looking at others. What we know about the changes in the brain is that when we have this imbalance of dopamine, there's a huge, significant jump in threshold for dopamine, which means the way that your brain interprets pleasure. And so things that would typically really give you a lot of joy, going to Disneyland, job promotion, kid doing well in school, watching Blanchard videos, things like this are really going to not hit the target when they usually would. And so what we're seeing is an elevated ceiling, an elevated touch point for being able to access some of that pleasure. Things that are typically going to feel good, going for a walk on a sunny day, being able to see your children doing well in school, that is really going to be masked, it's going to be blunted, and we call that anhedonia. This is pleasure deafness, and so if you consider that, what we're looking at is those senses have been completely reduced, and it's going to take a whole lot more dopamine to hit that threshold, similar to the identified patient when we talk about escalating use and tolerance. We've all got tolerance changes going on when it comes to dopamine. So the big question is, if we're looking at all these brain systems, we're looking at the changes that are happening, why are we here? Why would a family module help me? Why does education help me? Why can some of this stuff actually help rewire my brain? And we have some really clear-cut answers to that. What we're looking at is shifting the whole family perspective and understanding that there's going to be one person typically in a family that starts this whole process. There's going to be a change agent in that family that says, I'm going to work on myself despite what others are doing. And this is a big shift for families who are putting someone in treatment or have a loved one in treatment, because a lot of times we're hyper-focused on that family member and we're saying if they get help, things will resolve. But similar to any other chronic illness, if I have a family member that's not well or has even experienced death as a result of a chronic illness, that won't resolve, no matter what they do, no matter what change process is there, it won't resolve the feelings and the trauma that I've experienced as a family member, having been in that family system. And so what we're looking for is you actually being able to be the change agent, you being able to be the one that steps in to change the family narrative. And so we look at families who are in this process. We look at families who are maybe in denial, they have their heads in the sand, right? We all have the family member, it's like, nope, that's not what's going on. We're gonna call it something else, or we're gonna call it nothing at all, and we're gonna go to a football game instead. And then we've got family members who are completely being split by an identified patient, arguing over how to handle things, trying to take control over it one way, being more lenient, being a lot more authoritative about things. And what happens is those relationships get completely split, especially in couples where you've got a mom and a dad, and you have another separate relationship happening between spouses. And this type of disease process can really get in the middle of those relationships and start to change some of that, really start to create a wedge down the middle. And I'm sure some of you have experienced the he told me and then she told me, well, you addressed it this way and that was the failure. And the difficulty is, as a family system, we're trying to figure out what the solution is, how we can really find a way to maneuver this in a healthy way or stop some of that triangulation. And so really the answer here is learning to put down that rope, not figuring out how to cut it, not figuring out how to tie it differently or anything like that. It's putting it down so that you're no longer being dragged around by this disease process. And that's not to say that you're not going to be affected by the disease. It's not to say that you're not going to get sad or angry or mad. But what it does mean is it's not going to control you. And so a lot of times we're looking at our identified patient and saying something else is controlling them. That substance is controlling their behavior, the way that they act in the world. And we lose the awareness that actually this is happening for us as family members too. We've started operating around the disease as well. And so what we know is what doesn't work to resolve all of this. This is a long-term progressive illness. This is something that occurs on a daily basis that needs treatment, both for a family member and for an identified patient. And yet what we look for is these really quick fixes. And so we'll go to professionals' offices and we'll go to treatment centers and we'll say, well, just tell me how to make this stop. Tell me how we can resolve it. And the issue is, as much as we want that short-term answer, we want that gratification, we want to be able to fix it out of good intent, there is no short-term solution to a long-term problem. And so what we're looking for is also driving some of that maniacal behavior where we feel like we just don't get off of the merry-go-round. It's either treatment center after treatment center or lecture after lecture that we're having with this person, and they're not getting better and they're not changing their behavior. And a lot of that comes from us thinking somehow that a short-term solution or even conversation is going to change what's going on when it's a long-term standing pattern. It may have crises, it may have spikes, but the solution is long-term, the illness is long-term. And what we really have to lean into is the acceptance that this isn't going to get better overnight. It didn't get this way overnight. And we have some solutions that are really going to be evidence-based, and they take a while. And that's really painful for families. We cannot hit this with a quick fix and expect it to get better. And so when we ask you to engage in any type of family programming, a lot of times families are really willing to come in the first day that you bring your loved one in for an assessment. You're dying to come into family programming, dying for the education. Give me the tools, tell me what to do. And then when the crisis passes, you're fine. You're practicing self-care, you're elsewhere. And that goes away. But the issue is there is no quick fix, and we actually haven't gotten started on the long-term solution. So these are the foundational materials that we're going to start to go through that really help you identify those first steps to that longer-term solution. You know, one of the biggest mistakes that we make is we look at others and we say, well, if they fix their behavior, this will resolve. And a lot of times what we see is we have folks put loved ones in treatment. They stop drinking, they get better. And yet all of the behaviors with the spouse or the parent or whoever it is actually remain, because that individual hasn't worked on their own remaining trauma symptoms, their own remaining experiences, and that's the work that still has to be done. And that's why we believe in family-focused treatment. We know that a lot of times families are looking for that solution. They're looking for, how do we get this better? How do we work together as a family? How do we build on the strengths? And we have those answers. When we can get you in the door, when we can get you educated, all of that starts to resolve. And so we see a lot of family members where this is the case, right? We just want to put them in treatment and we want them to get better and we want it all to get better and to go away. And the reality is family programming and family recovery is really a lot more about putting down that microscope, picking up the mirror and starting to acknowledge some of the things that maybe your own patterns, maybe things that you're actually contributing to this disease process with that maybe you weren't aware of. Maybe you didn't know was unhealthy to be doing. Maybe it's something that's coming from that survival part of the brain that's really natural. It's just not helpful. And so we're here to talk through a lot of what those things are. And so what we look at in family programming is just starting to shift this family perspective. I know for me and my family, a lot of times what was happening is all of the members in the family were really trauma bonded over the active mental illness or the active substance use disorder in my family system. And what that looked like in practice was I would call my mom and say, "How are you?" And she would respond with what was going on with my brother. He's been arrested again, he's in detox, one of those types of things. And what I'd call to ask was, "How are you?" And what happens there is we stop operating in relationship with others and we start operating only in relationship with this disease process. And there's just no healthy way to do that. And so what happens with these family members, including the person of concern or identified patient, is we're trauma bonded and we're all operating out of the only thing we have in common is the trauma of this disease system. And so what we're advocating for is a shift in this perspective where we're all looking at us participating in our own version of recovery from the illness existing in our family. And so there's no one person at the center, and there's no one disease even necessarily at the center. It is mental health, it is substance use disorders, it is any other chronic illness. And for each person in the family system, it's their responsibility to begin to work on the effects that that disease process has taken on you. And that is yours, and no amount of someone else getting treatment of any form is going to resolve some of those symptoms for you. And so this is what we look at, taking this step into how do we shift this family perspective? How do we get you on board to start looking at some of your own stuff? What this will do is help change the current dynamic. I don't know any of us that are real successful in telling other people what they should be doing, what they could be doing differently, or what you will do. But what I know is we're really drawn to people who begin really uncomfortable, really vulnerable processes, who say, "I'm really going to work on myself. I'm going to change these things. I'm going to be self-aware." Or maybe it's even just, "I'm going to acknowledge some things that I think that I've been doing that may not be healthy." And what we don't have to do is wait on someone else in the family system to do those things. We are able to initiate that, and that can change the entire family system dynamic. So what we're asking is for you to become a change agent in your family system. If you could become that one person that takes the first courageous step forward and says, "I want to work on this. I know that I've been impacted by this," that is super helpful. That encourages change in the family system. When people start to see some of the benefits of actually working on your own recovery, it does inspire others, but what it also does is start to extinguish some of the unhealthy things going on in the family. There are some prerequisites to being able to do this work, unfortunately, and that means really shifting the way that you're feeling about things, shifting the way that you're thinking of others. Others are not objects, others are not barriers that you have to get through, they're not people you have to move aside. It's being able to actually see people from a heart of peace and having empathy from others. And this is really difficult when we're talking about some of those chemical changes that have happened in the brain, because naturally we go into fight or flight and we go into how can I combat this threat. And your family members, barring some exceptions, typically aren't threats to you. There's a lot of strengths that you can actually build on as a family. But being able to resolve, or at least set aside some of that war that we have going on internally, can really help you step into this. And the danger is if you stay in that place of war, if you stay in that place of anger, and that's where you choose to live in resentment, in anger, in frustration, what actually happens is we're investing in the disease process because we're not working on solutions. We're not working on our own way out. We're just actively working on still being angry, which keeps us stuck. And so what we're advocating for is taking a look at, where can I find empathy, even if it's one thing. Where can I find some love for this person? Where can I find their strengths? And where can I find that for myself? And where do we begin to work on some of that? The danger with staying at war is really that we're going to be colluding with that disease. We can actually help it progress. And that's really difficult for us as family members to acknowledge, that somehow something that we're doing that we think is really maybe going to control the disease, going to extinguish the disease, could actually be contributing to it. It's really painful. And it's the reality. And so I think there's a lot of work to be done in just picking up that mirror and going, what am I doing? What are these patterns and how do I begin to resolve them? And so when we're not willing to do that, we're never able to get to the deepest part of the issue. We're never able to get to the solution, and that keeps us stuck. And so what we're looking at is full family realignment. And as much as we may want a quick fix or a workbook to work on, this is deeper than just having one day of healthy communication or having family meetings, which we hear a lot. I have a family meeting and I think that that's going to resolve some things. And the reality is there's no short-term change to these things, and family systems are really complex and they evolve over time. And we just have to be someone who inspires that to continue to change, or to change for the first time in a really long time. This work you can expect to be uncomfortable. I don't know of any change in a family system that usually invites a whole lot of excitement. Even if folks are really on board with it, it still creates tension. It still changes that system in some way. And as humans, we crave that homeostasis. We crave that balance. And this, in a healthy way, will really offset that for a little bit. And so we're going to dive deeper into what is a family system, what makes up a family system. And this is really the foundation for the rest of the learning we're going to do throughout the modules. This is something that helps you understand, before we start talking about my family, before we start talking about what we need to do, we have to understand what we are and how we function. And so what is a family itself? We are like organizations. We're like living beings. We're oak trees. We are things that live, breathe, evolve. We're systemic. And so what we look at is a family system is going to be made up of these different parts. It's going to be linked together. And again, that can shift and become really unhealthy if we've got that rope tied between all of us. But we're linked together in a lot more ways than that. And a lot of times it's just getting back in touch with what are some of the positive ways that we're linked together. The system is designed to accomplish a common purpose. We work together as families. You often hear those family stories of, we always got through this. We are people who, we are a family that has always. You start to hear some of those stories and you really realize that families have common purposes. Families have goals. Families have those narratives, and we're all linked together because of a lot of those things. When we're starting to define family, it's important to point out these family members don't have to be blood relatives. And I think a lot of times that is what people cling on to is, well, they're not family or they are family, and this very rigid line of what that may mean. If they're part of your support system, they really matter to you. I know I have friends that are like family to me, and that is important to include when you're defining that family. We have a living, changing organism. This may have looked very different 5 years ago, 10, 20 years ago than it does now. It will probably look very different 20 years from now. And so if you're looking at changing some of these pieces, understand it is a longer term process. I know for myself and my family, we've got members of the family that still have a lot of influence over what we do, what we say, where we gather, and those folks are actually deceased. And so consider those folks part of that living, changing organism as well. Because if they're still exerting a lot of influence over that system, it's important that they're included in some of those discussions. It's important that they're considered when you make some of these changes. A lot of these things are going to be linked together by the rules that a family has about who we are, what we do, what we say, what we don't say, what we participate in. And these are important to sort through in a really dissected way, because a lot of this is going to dictate how a family reacts to things. So rules in a family system help us establish attitudes, expectations, goals. Certainly we're going to talk about family values. I know for my family, it was, we were reminded of the values. We are a family that does this. We believe in this. And a lot of families feel very strongly about these things. These rules help us know how to operate in that family system. They help us know how to adapt to change. They also help us establish or identify who holds the power and authority. For a lot of families, there are spoken and there are unspoken leaders in the family. We all know if mom is the one who actually signs off on things versus dad being the one who makes the rules. This helps us understand how we're supposed to respond, who we go to about what, how rules will be used in the household, or even beyond the household in the greater family. It helps us really anticipate and perform when we're going through change. If we've heard this family narrative that our family always toughs it out through change, we're like Phoenix rising, we always come up better on the other side, things like that, they help you kind of lead this path already for the expectation that the family system has if something happens. What it helps us do is it helps us dictate how those family members will communicate and also what we're allowed to communicate about. What do we talk about? What don't we talk about? What are we allowed to talk about? What are we certainly not going to talk about? Those things are important, and those help us function, and they help us have predictability, which we really enjoy biologically, just knowing what are we allowed to do, what's safe and what's not safe. And so they also help us dictate behavior, emotional expression, and how we relate to one another. I often heard phrases in my house like, "That's your brother, don't say that to him." Versus maybe if it was my uncle, I would have been allowed to say that to him. Things like that matter. They help us understand what guidelines are in place for what we do, what we don't do, who we talk to, who we certainly don't talk to, and just start to establish some of those family values, but in more concrete ways. Some of these things are simply understood. Some of them are unspoken rules. Some of them are explicitly expressed, and so I'm sure some of you can think of some examples of household rules that you had or family rules that you had, and also come up with some things that no one ever talked about, but you just knew you couldn't do. Some of the examples for family and household rules: be nice to everyone, children should be seen and not heard, control your feelings, always look at the bright side of things, father knows best. These things are really important, and not all of them are unhealthy. And so as we go through these things, it's important to understand we're highlighting these as things that happen in any family system. And as we talk about mental illness and substance use disorders, we're going to look at things that become illuminated or highlighted when you have that active in the family. But these exist in all families. Something like control your feelings can be a really dangerous rule, because what it does is it doesn't allow for any possibility of expression of emotion. And so when you look at the ramifications of a family or a household rule like that, and what can really happen, is I've now learned that if I have to control my feelings, well, that's not realistic. So now I've got to figure out where I take my feelings. And I've now just learned who's safe and who's not safe to take my feelings to, what it means to control your feelings versus express them. And all of this can happen at a really early age, or it can change throughout time. And it's important to just have open communication about what some of the family rules are, because they really dictate behavior. And these things will really come up or be highlighted when we start to shift some of the family dynamics. Folks who are having a hard time with rule changes will often go back to these and say, remember, our family does this, or our family doesn't do this. So when we start to dissect these, we have three different types of family rules. We've got human versus inhuman, rigid and flexible, and then open and closed systems. And so when we're talking about inhuman rules, we're talking about rules that are made up for someone else's benefit. This is typically that this person is going to be uncomfortable with anything operating outside of this rule, and so it keeps them in their comfort zone. The issue is, if it's something like control your feelings, that's not realistic. Humans have feelings, that's going to happen. But the rule control your feelings is really made to dictate what is safe to share, what is safe to express. And so what I'm really saying is, I'm uncomfortable if you express your emotions. I'm uncomfortable if you come to me and you're crying because I don't know what to do, or then I have feelings. And so the rule, control your feelings, is made to protect that person that's more comfortable somewhere else in that spectrum of emotional expression. The issue with this is it's often unrealistic, it's impossible to keep, And so if you have a rule that says control your feelings, what you're doing is really encouraging some dishonesty, encouraging some manipulation. Because if that's the rule and I can't do it, then I've failed. I'm going to be rejected from the family. I'm going to be punished. I'm going to be scolded for these things. It's just not realistic to adhere to. And so what happens is that underlying feeling of guilt of I couldn't uphold the family rule, even though it's not a realistic rule. And I'm not allowed to talk about that guilt either. And so where else can I take that? And so you can see the opportunities there for what else happens with those emotions. Everyone's going to do something different with that, right? We can stuff them down. We can be overly sensitive with other people. We can learn that this is the person I always go and cry to, but at home I have to wear a mask. And all these things can be unhealthy because we're just not being allowed to be human with our family system. When we look at human rules, what we're looking at is something that's created for the benefit of the whole family system. So it's not just keeping one person comfortable, it's really allowing for the expression and the individuality of each person. They're human, it allows people to have separate feelings, individual feelings. You know, it understands that humans are sometimes fallible. It allows for that failure to happen. It doesn't mean that there's no accountability. It doesn't mean that we excuse behaviors. What it means is it just validates the worth and existence of everyone involved. And yes, we can still address that with consequences. Yes, we can still address it in a way that's appropriate, but it at least allows for it to happen and be addressed in the household. We have to be really careful to allow people to do things that people do, and then make adjustments based on the family rules about how we're going to handle it once it happens, not say it can't happen. When we look at flexible rules versus rigid rules, what we're looking at is the difference between there's some gray area and it's very black and white. Not all of these are going to be unhealthy rules. And so when we look at rigid rules, making no allowance for something to happen doesn't have to be unhealthy. You know, making a rule like there's no violence in this house is not an unhealthy rule. It is very rigid. It is very black and white. If it happens, it's not tolerated. It will not happen. And that's okay. It's just very rigid. And so when we look at this, what we're saying is it can be appropriate, but it discourages any change. It's something that we know a family system is just not willing to participate in gray area on, and they hold very firm to it. The issue is when we start to shift some of the family system, there's going to be tension around a rigid rule. That can also be a healthy thing. If there's no violence or there's no use of drugs and alcohol in this house, and I hold firm to that as a family member, and I have a family member that's using, you can expect tension. There's a rule that's directly being violated and someone who's willing to hold that rule as a boundary, and that can actually be a healthy thing. And so don't make the mistake that rigid rules are bad. You know, we try to really get away from the words good or bad and look at what's healthy and unhealthy for a family system. Rigid rules can be healthy things. When we look at flexible rules, what we're looking at is understanding that different circumstances call for different rules. There are different scenarios where maybe something would be allowed versus not allowed. You know, treating your children differently is perfectly natural. Children have differences in personality. They have differences in what works for them. They have different thresholds or tolerances. And it's important that we're flexible with those things. That actually allows us to appreciate the differences between the individuals and in the needs of those individuals. So maybe for one child, I have a rule that's this, and for another child, I have a rule that's that, because that's what's needed to accommodate their needs or their individualities. This actually allows for the acceptance and encouragement of changes in the family system. What we look at is in the family recovery process, a lot of times the rules do have to be flexible to just allow the family system to participate in family recovery and grow as individuals and still be a family system. That any change or any progress that someone's making in the recovery isn't challenging to the family system, that it's being allowed, that we're actually seeing that as some potential that there could be positive change. There could actually be some adaptation to some of the rules that we created that we thought were healthy, that now we're gonna have to just change for a little bit. When we look at the difference between open and closed systems, what we're really looking at is how much do we communicate, what do we communicate about, and who's deciding this. So what do we talk about? What are we not allowed to talk about? What do we just completely ignore? So common subjects that we're talking about in this category is, for me, in the culture that I grew up in, it's very taboo to talk about money. And that was very difficult when I started planning a wedding, and I had to uncomfortably ask multiple times, well, I hear you keep saying, yes, we can do that, yes, we can do that. How much does that cost? And then I saw the discomfort happening when, to me, growing up in the American culture, thought that was a perfectly normal question to ask. I'm paying for this, I'd like to know how much it is. But understanding the general rules culturally or family system-wise about what is okay to talk about, what is the right way to talk about some of these things, how many people can you talk about this in front? Is this more of a private thing that you do? And so what we look at is substance use, sex, illegitimacy, looking at infidelity, different things that are happening between parents, fights between parents, any type of religious discussions or doubts that you're having. Think back to some of the rules that your families had around these, and this is a lot of what we're looking at when we look at open and closed systems, is just what can we talk about and what can't we talk about. So when you think about a closed system, what we're looking at is discouraging folks to be open about the way that they're feeling, the thoughts that they're having, the moods that they're experiencing, the dreams they may have. It's really just we talk about what we need to talk about. Otherwise, the closed system is going to say, if it doesn't need to be discussed, if it doesn't need to be an open thing, let's just not. And what this can produce is a lot of helplessness, a lot of fear, a lot of concern. I know when people aren't communicating with me, a lot of times what happens is I develop my own conspiracy theories. And so in closed systems, there's a lot of assumption-based discussion going on because we're not openly communicating about some of the issues. Any of the feelings that the rule maker would rather not hear, again, that person really protecting their own comfort, their own space, that is the arena where we're going to discourage anything from going on because the rule maker has said, this is our box and this is what we stay in, and it's very closed and we don't talk about that. What happens is the members in the family are going to feel like they pay a high price. Anytime I feel like I pay a high price for having a discussion that's vulnerable, having a discussion that I want to enter, if I have to pay any type of price for that, meaning it's not received well or it's shut down, especially in a closed system, I'm very unlikely to try again. And so what happens is we actually stop sharing feelings altogether. It's not safe to go to you when I'm sad, then you don't deserve for me to go to you when I'm happy, and so I'm just going to stop sharing. What happens is natural distance between those members of the family, because what else could there be in a closed system? If we're not allowed to talk about what's really going on, what's the point in talking? And so we end up withholding a lot of information. We end up having a lot of emotional consequence from this type of system. What we also don't allow is for other people to participate in the communication on the outside of the family system. So if you think about family members who would say, that's a household issue, we don't talk about that outside of the family. We don't talk about this at school. We don't talk about this at work. We keep this in the house. We keep it in the family meeting, and really closing off those borders. What that also closes off from is outside opinions, outside feedback, outside solutions. And so what we're doing is really remaining sealed off from any type of support, help, feedback, progress, change. And when that happens, we can start to feel really isolated in that family system. When we look at open systems, what this allows for is that free communication, that expression of all your needs, all your feelings, without paying a price. And it allows for outside borders to be a little more meshed. And so things are allowed in, things are allowed out. And in that way, we can openly communicate about things. Now, there is a real spectrum here where we're looking at a very closed off system that can become very unhealthy, very isolated. And then we can look at all the way on the other side, a very open system where we're sharing inappropriately, we're oversharing, we're not respecting boundaries, we're telling other people's secrets, we're just oversharing. And so as you can imagine, like anything else, anything on opposite ends of the spectrum can lead to a lot of consequence, and what we look for is a really healthy balance in the middle. We also look at healthy boundaries, being able to explain to people what you're comfortable communicating about, what you're not comfortable communicating about, and just being able to have that dialogue as a healthy place to live in the middle of that spectrum. Now, it's important to understand that there's a big difference between the need for privacy and then secrecy and dishonesty. You know, if you're in a real closed system, there's a lot of secrecy, there's a lot of dishonesty if you are branching out from that family system. But what is healthy in a lot of adult relationships and a lot of family systems, there are things that should be kept private. There are things that should be kept between a mom and a dad from the children that are inappropriate. There are things that should be kept from the outside world. And so no one's saying that that's unhealthy, but just recognizing the difference between secrecy and privacy. So what we look at is, what does this look like in a misaligned system? So in a system where we've got mental illness or substance use disorders present and active, we've got the trauma bond going on that we talked about earlier. And so that becomes the most important thing in our life. That becomes our rope, where we have to share that because we can't share external things. We're completely bonded over that. What's going on with him? Where is he? How can we help him? How can we prevent him? You know, I think a lot of us as family members start to actually experience the illusion of control that our identified patient goes through with their substance. You know, if I can just do this, it's going to be different. If I can just use once, if I can just have 2 beers, I'll do it differently this time. And that illusion of control actually keeps us stuck in our disease process. As family members, what that looks like is I have to stay home because that will keep him safe. I can't go to the Bahamas because then he will smoke weed if we leave. He's going to run away if we tell him no. And that's really the illusion of control, because what's happening is that disease process is existing regardless of our failed attempts to control it. And you can see the parallel there with some of the identified patients' behavior. So the issue is, as I mentioned before, as families, we want to keep that homeostasis. We want to find the balance. We want to get back to what's comfortable, even if what's comfortable is really antiquated and really not working for our system anymore. It's what we desire. It's what we want. And so what happens is we start to adapt as family members into what we see as the healthiest thing, what we're most comfortable with. And we're starting to operate out of survival, because there's nothing normal about having to watch a loved one go through this type of trauma. And there's nothing normal or healthy about having to experience this trauma either from the progressive illness. And so the result is just that there is maladaptive behaviors that exist in a family system that, unbeknownst to us, are actually contributing to a progressing illness instead of starting to extinguish it. And this is where we really try to help family members understand, despite your best efforts, despite the best of intentions, and even the education that we have, there is just no way to healthily adapt to what's going on if there's active substance use disorders and active mental illness. It is traumatic, it is difficult, it is exhausting, and there's just no way for us to be brain healthy in that environment. And so what we have to do is focus in on, what can I change? What can I work on? How can I get healthy? And so what we're looking at is just getting untrapped in the disordered system, looking at getting out of behaviors that maybe you're engaging in that completely are keeping the status quo, trying to keep everything together and trying to control the illness that's going on. In those efforts, if you're starting to feel like you're going crazy and no matter what you try isn't working, you're probably right, and it probably is very painful, very exhausting. I know as far as the facility that we have and the treatment levels of care that we have, oftentimes when family members or spouses bring their loved one into us, they actually look as tired, as disheveled, as exhausted, and as ill as the identified patient. Purely for this reason, that there's just no healthy way to approach this when you don't have the education, to manage it when you don't have the support. And so getting engaged and starting your own process is vital. And so this is our plea when we look at some of the shift of family perspective. What you've learned today is really the foundational basics for what is a system, what makes up a family, What does a family mean? What are the rules? How do those help us dictate behavior? And also, where are we going to get caught when we start to shift some of this perspective? And so what we're asking is that everyone in this circle really begin to identify what could be my first step in starting to shift some of this family perspective, starting to pick up the mirror a little bit, put down the microscope, and really learn, what am I responsible for and where could I recover? And so I hope that today has been helpful. I hope that these foundational basics have helped you at least have the education to know every family ticks like this. Every family experiences some of these things. It's a very healthy and normal existence to have these rules in families, and also be able to start to open up a conversation about where the rules could maybe have you stuck. And so we hope with these tools today, with those being the building blocks for the remainder of the modules, that this will be helpful in the continued learning. Thank you.